Despite the fact that magnesium is an incredibly important nutrient in the body, magnesium-rich foods aren't talked about nearly as frequently as much as we fuss over our protein, vitamin D, and iron intake. This is unfortunate as magnesium deficiency is incredibly common. Magnesium deficiency is running rampant among Americans. One study sponsored by the National Institutes of Health shows that 68% of Americans don't get enough magnesium. Other experts put the number closer to 80%. So in this video, we're going to discuss 12 warning signs your body needs more magnesium. The video is going to be amazing, so make sure you stick to the end. Before starting the video, be sure to smash that like button and subscribe to never miss out on any of our videos. Number 12. You have high blood pressure or heart disease. Magnesium works with calcium to support healthy blood pressure and cardiovascular health. High blood pressure or hypertension can be a sign of magnesium and calcium deficiency. And since hypertension is the cause of 50% of all ischemic strokes, it's best to practice preventative medicine and get your magnesium. A study published in the American Journal of Clinical Nutrition found that a diet rich in magnesium may reduce the risk of a stroke by 8%. Another study in the Circulation Journal tested the effectiveness of magnesium supplements on patients with heart disease and found that heart disease patients who took magnesium twice a day for 6 months had better physical stamina and healthier blood vessels. Several reviews have concluded that magnesium supplements may lower blood pressure, especially in adults with high blood pressure. Put simply, magnesium deficiency may increase blood pressure, which in turn increases the risk of heart disease. Nevertheless, more studies are needed before its role can be fully understood. Number 11. Muscle twitches and cramps. Tremors, twitches, and muscle cramps are indications of magnesium. In worst-case scenarios, the deficiency can even cause seizures or convulsions. Researchers believe that these symptoms are caused by a greater flow of calcium into nerve cells, which hyperstimulates nerve endings. Also, lower levels of magnesium in the body can result in a buildup of lactic acid, causing pain and tightness in the muscles. Taking magnesium can help relieve pain and soreness, as it helps to alkalize the body and keep healthy pH levels in check. Unfortunately, for older adults experiencing cramping, getting rid of the muscular discomfort isn't as easy as supplementing with magnesium, even though studies show the mineral can help relieve cramps and twitches in the other groups of people that are deficient. Magnesium deficiency can also cause a secondary deficiency, hypocalcemia, or lack of calcium, which also causes muscle spasms and cramps. So truly getting rid of them likely requires the correction of both conditions. Number 10. A lot of stress. Stress can be a cause of magnesium deficiency, and a lack of magnesium tends to magnify the stress reaction, worsening the problem. In studies, adrenaline and cortisol, byproducts of the fight or flight reaction associated with stress and anxiety, were associated with decreased magnesium. Because stressful conditions require more magnesium used by the body, all such conditions may lead to deficiency, including both psychological and physical forms of stress, such as surgery, burns, and chronic disease. Number 9. Chronic fatigue. Feeling a bit tired every now and then is one thing. Constantly feeling physically or mentally drained is a non-specific symptom that may point toward a magnesium deficiency when paired with other warning signs. Specifically, scientists believe chronic muscle weakness may be caused by the loss of potassium in muscle cells, often associated with a lack of magnesium. Again, this isn't a definitive symptom. At the same time, if it presents alongside other conditions, you should absolutely mention chronic fatigue to a doctor. Number 8. Hormone imbalances. If you experience crazy ups and downs before or after your period, it's likely your body is deficient in magnesium. The higher the estrogen or progesterone levels in a woman's body, the lower the magnesium. This is also why pregnant women experience more leg cramps. According to Dr. Carolyn Dean, author of the book The Magnesium Miracle, muscle cramps related to the menstrual cycle can also be related to magnesium levels. She recommends women with bad premenstrual syndrome and cramps take magnesium early in their cycles before the symptoms begin. Number 7. Poor sleep. You won't be your best if you don't get in a solid 6 to 8 hours of sleep. Leading on from reducing sleep, magnesium supplementation before bed can improve your ability to fall asleep, stay asleep, and feel more energized upon waking. One study in 2012 was shown to improve melatonin production and reduce cortisol levels, resulting in better sleep and greater recovery. Poor sleep quality can be a sign of magnesium deficiency, and can even lead to insomnia, anxiety, hyperactivity, and restlessness. One study found that taking magnesium before bed improved sleep quality. There are many promising studies out there to show how magnesium can impact sleep for the better. Thanks to a neurotransmitter called gamma-aminobutyric acid, GABA slows your thinking down and helps you ease into sleep mode. Too little magnesium in your diet could be leaving you with racing thoughts and poor stress management at night when all you want is to catch a few Z's. Number 6. Asthma. Magnesium deficiency is sometimes seen in people with severe asthma. Additionally, magnesium levels tend to be lower in individuals with asthma than in people who don't have this condition. Researchers believe a lack of magnesium may cause the buildup of calcium in the muscles lining the airways of the lungs. This causes the airways to constrict, making breathing more difficult. Interestingly, an inhaler with magnesium sulfate is sometimes given to people with severe asthma to help relax and expand the airways. For those with life-threatening symptoms, injections are the preferred method of delivery. However, evidence for the effectiveness of dietary magnesium supplements in individuals with asthma is inconsistent. In short, scientists believe severe asthma may be linked to magnesium deficiency in some people, but further studies are needed to investigate its role. Number 5. Seizures without an existing condition. Consider this one of the most severe potential signs of magnesium deficiency. Several conditions cause recurring seizures, but they don't typically occur completely at random. Scientists believe sudden, unexplained seizures may be caused by dangerously low magnesium levels because a significant lack of this mineral can cause abnormal electrical activity in the brain. Experiencing an absent seizure and any other recent symptoms may indicate a need for a dietary overhaul, magnesium supplementation, and possibly a few lifestyle changes. Number 4. Pregnancy discomfort. Similar to hormone problems, low magnesium levels can adversely affect pregnancy health and mood. Some women report less morning sickness during pregnancy when supplementing with transdermal magnesium. Magnesium can also reduce hypertension and muscle cramps during pregnancy. Supplementation can also help to ward off preterm labor and alleviate headaches. Number 3. Irregular heartbeat. Heart arrhythmia or irregular heartbeat is among the most serious possible effects of magnesium deficiency. Arrhythmia can range from causing no symptoms to causing very serious symptoms. In some people, it may cause heart palpitations, which are pauses between heartbeats. In the most severe cases, arrhythmia may increase the risk of stroke or heart failure. Scientists believe that an imbalance of potassium levels inside and outside of heart muscle cells, a condition associated with magnesium deficiency, may be to blame. Some people with congestive heart failure and arrhythmia have been shown to have lower magnesium levels than people who don't have heart failure. Similar to muscle weakness and fatigue, this problem is thought to be due to a potassium imbalance caused by magnesium deficiency. Arrhythmia can lead to symptoms such as lightheadedness, chest pain, shortness of breath, or even fainting. It can also increase your risk for heart failure or stroke, so be sure to consult your doctor if you're experiencing any of these symptoms. Number 2. You're pre-diabetic or have type 2 diabetes. Magnesium plays an important role in the way your body metabolizes sugar. Magnesium aids in the activity and release of insulin and in maintaining healthy blood glucose levels. And magnesium deficiency can not only be a cause of type 2 diabetes, but also a symptom. Diets rich in magnesium have been shown to significantly lower the risk of type 2 diabetes. A recent study found that adding just 100 milligrams per day of magnesium lowered the risk of diabetes by 15%. Number 1. Osteoporosis. You likely know that vitamins are involved in your risk factor for developing osteoporosis, specifically vitamins D and K along with old age. Magnesium-deficient people are also at a higher risk of developing the condition that weakens bones and puts people at a higher risk of fractures. But getting enough magnesium can help in more ways than one. Adequate magnesium intake is associated with higher bone mineral density and can prevent hypocalcemia. Though magnesium, or lack thereof, can act directly on your bones, it also affects their strength by causing a lack of calcium. Of course, there are just some symptoms that may occur with a magnesium deficiency. Each person may actually experience all, some, or none of these symptoms, even in the presence of a deficiency. Let us know your opinion in the comment section below. This is all for today. Hope you liked the video. Don't forget to subscribe to our YouTube channel. Please click on the next video clip to watch for more health info. Thank you very much.